So I've had a number of my constituents reaching out lately to share their concerns about how Danielle Smith and the UCP are forcing Albertans to pre-register and pay to get access to the COVID vaccine. And I just want to say I share those concerns. I mean, Alberta's the only province doing this. It's going to have some serious impacts on our health and our healthcare system. Now, Danielle Smith says it's about cutting waste, saving money. Because people, well, they just aren't getting the vaccine, but that's a lie. I mean, hey, the UCP's public reasons for doing the things they do usually are. This isn't about being responsible with tax dollars. I mean, hey, the UCP are wasting those left, right, and center. This is about catering to anti-vax conspiracists in their caucus, their party, and yeah, probably even the Premier's office. Let me explain. First thing we should note is that Danielle Smith has a long history of being, shall we say, skeptical about COVID-19 vaccines. I mean, back in 2021, health authorities, Canada, and most other jurisdictions, all pretty much unanimous that COVID vaccines are safe, effective, and everyone who is eligible, including children, should get it. But Danielle Smith disagreed. She had a page on a members-only subscription site where she was saying things like, quote, "It's actually those who are triple vaxxed who are the ones who are most at risk of hospitalization and death." She was saying things like that the vaccines, quote, "had no obvious effect on COVID deaths and may actually increase deaths from other causes." Now you jump ahead to 2022, UCP leadership race. She's running and she's claiming things like, quote, "There's very little evidence that anyone under the age of 35 really needs to have the shots at all." She's even saying that for people under the age of 18, the vaccine would likely cause more harm than good. Now, of course, she won that contest. And after she was sworn in as Premier of Alberta, well, one of her first public statements was this.
"Those who made a choice not to be vaccinated have been the most discriminated against group that I've ever witnessed in my lifetime."
So perhaps it's no surprise that 1 year later, fall 2023, with respiratory virus season on the horizon, the UCP decided to interfere to weaken Alberta's fall vaccination campaign. I mean, staff in Alberta Health, under the direction of Minister Adriana Lagreen, they ordered AHS to delay talking to the public, told them they couldn't use the words COVID or influenza, and demanded they limit any information about the benefits of vaccines or how effective they are. I mean, that's unprecedented. And unfortunately, it had an effect. Over the next 2 years, vaccinations for both influenza and COVID fell to their lowest levels in a decade, while deaths from influenza have hit all-time highs. April 2024. Globe Mail reveals that shortly after she became Premier, Danielle Smith struck a task force to review how our healthcare system had handled the COVID-19 pandemic, and it's headed by a doctor who had accused hospitals of lying about the impacts of the pandemic and the number of people that had been admitted into them. Well, around the same time, UCP MLA Eric Bouchard holds a town hall titled An Injection of Truth, and it features a colorful array of anti-vax conspiracists and grifters. Now, he was supported by both the Premier and the United Conservative Party, who promoted the event on their website. And at his town hall, his invited experts, which included members of the Premier's COVID task force, made a number of just ludicrous claims, including claiming that the COVID vaccine was responsible for over 3,000% increase in excess deaths in children. That is deaths beyond what we normally expect. Then in July 2024, MLA Bouchard goes on the podcast Unscrew the News and says this.
"I've had multiple lengthy conversations with Health Minister Lagrange, and there's no set date, but my win would be when the shots are removed, of course. But as I mentioned, government moves incredibly slowly, so it's begun. So the wheels are in motion. I'm hoping sooner than later. I'm very optimistic."
Now, Minister Lagrange's office, they don't deny that she'd spoken with Bouchard, but they insisted, quote, "Alberta's government is not considering any changes to COVID-19 vaccine funding or access." Well, a few months later, fall 2024, UCP announces that Albertans won't be able to get publicly funded flu or COVID shots from their family doctor. January 2025, Danielle Smith's COVID task force releases their report, which calls for limiting use of the COVID vaccine, including, quote, "ending their use in healthy children and teenagers." March 2025, the head of that task force, Dr. Gary Davidson, he appears at MLA Bouchard's second town hall, and he calls again to ban the COVID vaccine for pregnant women and young children. Then we get the announcement from the UCP that not only would the vast majority of Albertans have to pay out of pocket to get the COVID vaccine, they'd also have to pre-register to get it, a system that doesn't exist for any other vaccine in Alberta or in any other province in Canada, as near as I can see. You won't be able to get it at your local pharmacy, only at a limited number of AHF clinics. Now again, Danielle Smith claims this is just about trying to prevent waste because gosh darn it, people just don't seem to want to get that COVID vaccine anymore. But as I've laid out, she and the members of her government and caucus have a long-standing bias against the COVID vaccine. And despite repeated promises to do the opposite, the UCP government has repeatedly spent their time in the last 2 years steadily working to drive down uptake and make it harder to get. I mean, they originally weren't even going to cover healthcare workers, even some of those who work with the most vulnerable patients in our hospitals. So it's clear this is not about waste, that's about ideology, a belief in misinformation that the vaccine doesn't work.
I think it's because it doesn't work particularly well, if you want the truth.
Now, thankfully, unions push back and the UCP reversed course. But for everyone else, well, you get to try to navigate this confusion of the UCP's new vaccine pre-ordering page in the hopes of maybe getting the privilege of paying $100 for one of a limited number of shots that they're willing to order in. It's not a vaccine ban, but hey, kind of the next best thing. Because while the UCP claim they hate red tape, hey, they've even got a minister to fight it. Well, they've actually just weaponized it to use against people and things that they don't like renewable energy projects, Albertans on AISH, and well, hey, public health and COVID vaccines. So to everyone who's reached out to me and my colleagues, we hear you and we agree with you. We're calling for Alberta to follow the lead of every other province in Canada and cover the cost of the vaccine for anyone who wants it, and to invest in a full public health campaign encouraging everyone to do so. And I encourage you to write to the Premier, the Health Minister, and your local MLA to demand it. Demand what's best for you, for your families, for Alberta workers, and for our healthcare system. Because better is possible. It's not, it seems, from the UCP.